therefore, we were also, as a sector, a bit politically irrelevant, because the attention of the government after government, was always around setting the basics right. Nobody ever realized that healthcare is actually a part of those basics. Because if you do not really deliver on good health, how are you going to really become a developed economy? So, but we were busy building the blocks of becoming a developed economy. And suddenly we find ourselves in a situation where we are no more a sustenance economy, but we are basically one of the fastest growing economies in the world. So India has found its rightful place in the sun of becoming one of the fastest growing nations and very progressively going towards a developed nation. And guess what? Suddenly, we find ourselves in the heart of the political conversation. Because suddenly, health begins to matter. The signs of how this is going to impact this sector are very much evident. Over the last 6 months, I don't think we've had so much of coverage being given to healthcare as it has been over the last 6 months. People who had no connection with healthcare are actually now talking about sustainability, profitability of healthcare, that the sector is going to get wiped out. And so therefore, Ayushman Bharat has become the controversy of the present times of Indian healthcare. Ayushman Bharat is here to stay because universal healthcare has been talked about for a very, very long time. And this is not just the present government, but this was being talked about for a very, very long time. India added close to about 450 million people over the last 25 years. But we still continue to spend 1% of our GDP on public healthcare spending. Who has been looking after this whole group of people? So the question therefore for all of us is, this is real. And I still find many times in many conversations, people believe that this is going to be just another passing phase. But the question is, the economics of healthcare are changing forever. And if you don't really get up and smell this coffee, we all are going to really face a very, very turbulent next 5 years, as Harish was saying, because it's all out there. It's no more about bundled packages and CGHS. Yes, that was the origin of our karma, as we call it, in terms of the origin of pricing. And therefore, from there, the waterfall has only gone down, and it has only sort of evaporated without really anybody looking at them scientifically and trying to really create a powerful ecosystem which will be sustainable. We always talk about NHS and social healthcare and healthcare which is being delivered in the developed economies and particularly of Europe, but their allocation to healthcare far exceeds every year in their annual budgets, whereas we continue to decrease them. So if this is going to be our reality, and if this is the time that all of us as healthcare providers are going to live in, then this is course correction. It is going to be very, very important as we move over the next couple of years to really relook at what will determine sustainability. Forget about profitability, because as Harish was saying, that if you look at all the stocks of the listed entities in healthcare, everybody has taken a beating for the last 5 or 6 quarters. I come from the financial world now, and I know that world over, healthcare stocks are being beaten basically because it's not just about growth anymore, but it is about whether these entities and the capital that they have raised will be able to create a return on capital employed, which is one of the key metrics of which quote unquote also goes as IRR in some manner, but that is more project and capex related. But return on capital employed is one of the very, very core and important aspects of financial health and financial stability of any institution. So if we have to go down this path, and if we have to stay relevant, then there are basically three broad areas that we have to really start thinking about. And many of these we've sort of looked at in the past, and we have passed it on, saying that, fine, in the years when the world was being rewarded and when the world of healthcare was being rewarded on growth, nobody really cared about what is my midline cost, what is my continuing sustainable supply chain cost, what's my marketing spend, how much am I paying to my docs. We all felt growth is going to be just keep on pushing this engine forward. So we really don't need to look at all this. The time really has come where the three broad areas around people, process, and technology are going to matter like never before. If you start on the first agenda, which is around people, Harish talked about transformative leadership and people actually trying to set the agenda of around how you really create leadership behind organizations. But I think the time has really come for all of us in healthcare to really start looking at the people agenda. And when you look at the people agenda, it's on both the sides. I think our doctors will have to participate along with us like never before in actually thinking about sustainability. Most often than not, that conversation never happens. When we talk to clinicians in all our groups, we never really have talked about the fact how sustainable are our organizations. Because year on year, that's one cost which is actually escalating and changing a lot. But we can't afford that anymore. So another aspect of the way that we need to engage on the clinical side is actually sitting down a lot more often than what we have ever done from a managerial perspective and trying to take our clinical community along with us to really show that this is not super profitable environments that we are living in. That we therefore need a lot more sustainable efforts to be put behind creating continuous stability of our organizations. Second, on the clinical side, which is becoming more and more relevant than ever before, is the connection between the consumable side and healthcare delivery. Just yesterday I was told that there are even x-rays are going to be price capped. It is not going to be very, very much in the future where all the activities where we felt we are never going to get price capped, it's all happening. We never really thought that OPD procedures are going to be price capped. It's happening. So if all that is going to happen, then where are those conversations? And where do those conversations begin? Those conversations actually begin not on the CEO's table. Those conversations actually begin in the outpatient chambers along with our clinicians. That's very critical for this environment. I think we've always hesitated to have those conversations, but no more. The supply-demand side on the clinical side and on the clinician side in this country has always created an equation which is never very balanced. And I make no bones about it. And because of this demand-supply gap, we've always had a very skewed ratio of where the payouts go. I think a lot of that has to change because we just cannot continue to be in that same situation anymore where payouts are far exceeding on bundled payments than what we have actually been underwriting to all these years. So some connections have to be created. The second thing on the managerial side, which I think is super critical for healthcare today, we have often, and even today as an industry, shied away in picking up the right processes of other industries. And I say time and time again, that one of the biggest lessons that healthcare needs to learn is to actually absorb the good practices of other industries. The good practices around telecom, the good practices of FMCG, the good practices of hospitality, the good practices of software, the good practices of the IT industry. We have shied away a lot over the last many, many years in trying to bring those practices into the healthcare domain, because we've all been so obsessed with the hierarchy of our healthcare delivery systems that does not allow us to think out of this black box of healthcare that we've created. A lot of those good practices around people, process, and technology are actually sitting outside of this sector. And it's very important, as this sector faces these kind of challenges, for us to actually absorb a lot more of that. It's not just about quality, it's not just about process, it is about how other sectors have actually deployed technology for it to become even more sustainable as far as their own companies are concerned. So I think it's that critical now that as managers, as CEOs, as administration, as people who head departments, both on the clinical and the non-clinical side, that we actually look outwards than inwards. For the first time in many decades of this industry, one has to think a lot more outwards than inwards, because you have to bring those practices in if you want to really make your institutions continuing down the sustainable path. The last one, which I believe is most critical, is the whole technology piece. We have often felt technology is only medical technology. And if you see, we are throwing more people per bed in our hospitals than ever before. And that's the easiest way that we have actually thought about people. Just throw more people in, 100 beds into 600 people. 1,000 beds into 5,000 people. If you look at on a per bed basis, and if you don't really go out and think about how the hospitality industry does, and why is it so much more profitable as an industry, and start thinking about hospital bed to a hotel bed and people per hospital bed and people per hotel bed, not taking into account of the fact that we are clinical environments and therefore we need a lot more to be done on a per bed basis, but you have to start thinking on a per bed basis and people. And just throwing more people at the problem is not going to really solve our problem. We have to think about technology, and we have to think about how technology can actually help us a lot more. Technology in our environments is a one-time cost. Yes, it goes and hits OPEX on an annualized basis when you start looking at AMCs and all the costs that you need to incur on an annualized basis. But if you start connecting the dot around the permanent cost that you actually have inside the system, which are people related, and then see some of the stuff that you can do with technology and how much that is going to cost, if you look at the 5-year curve on that, you are going to be far better off as an enterprise putting more technology to work. I think it's important. If we are going to be living in the world of bundled payments, this is not going to give you any headroom to actually increase your revenue. It's going to get worse. And if it gets worse, you have to look at cost from a very differentiated thought process. And these are some of the things that are probably going to help us as we begin to think cost. Healthcare entities for a very long period of time have looked at revenue. We all looked at revenue and we felt that, okay, fine, you just keep on putting more capex in. The demand-supply gap of the opportunity was just so large that you would continue to drive more and more capex on the ground and therefore keep on adding more beds. The general thumb rule of internal rate of return, or IRR as we call it, is that if your cost of capex increases by 10% on a per bed basis over revenue per bed, your IRR actually gets hurt by almost about 35-40%. We in this industry have had delays in projects as if it just doesn't matter. I heard somebody from Yes Bank talk some time back, but one of the biggest discipline factors which healthcare actually needs to incorporate in itself is actually to do its projects on time. I do not know of a single entity in this country which has ever, including all the hospitals that I ran all my life, where we have always been on target in terms of our projects. 6 months, 12 months is an average delay. And we all blame it somewhere regulatory, somewhere this. Guess what? 1 year of delay on your project is capex dug into the ground, actually IRR gone from 15%, 18% down to 11 and 12%, which takes away the health of that institution. So the point that I'm trying to make, ladies and gentlemen, is that it's extremely important for all of us to start looking at the cost agenda. That it is extremely critical for this industry, and we, no matter how much we keep discussing in rooms like these, that Ayushman Bharat is a no-brainer. CGHS is filled with issues. ECHS never pays. Arogyashri, turnaround time of debt cycles, 1 year. That's our life. We've got to open our eyes to this life. We cannot get away from this. It is going to be here. And therefore, it is upon us as enterprise, as leaders, as people who actually create enterprises and lead enterprises, and people who actually put money on the ground, because private healthcare, guess what, provides 70% healthcare to this country. We are an essential part of this ecosystem. We can't be shoved away and said you don't matter, because guess what? Ayushman Bharat is going to be delivered by private healthcare in this country. It is not going to be delivered by only the public side. So we matter, but we are going to be pushed in this agenda of cost. And therefore, I wish you good luck, and I wish you great success, and I wish you that you go down into your rooms, and into your theaters, and into your cath labs, and into your neuro labs, and into your outpatient departments, and start thinking productivity, because that matters. Thank you very much. It's a pleasure.